Hi, my name is Julia Payne, and I am a nurse practitioner student. I'm just coming in here to talk with you and your family about your diagnosis of aortic stenosis. So, aortic stenosis is a condition where the aortic valve narrows, and when it narrows, it restricts blood flow from the left ventricle to the aorta, and the aorta is what distributes blood to the whole body. This happens a lot of the time due to calcifications and degenerations. So just age-related calcium deposits on the valve leaflets cause them to stiffen and to narrow. It also can be caused from a congenital defect or rheumatic fever. As you get rheumatic fever, the inflammation of rheumatic fever can lead to scarring and fusion of the valve leaflets. So the left ventricle, what happens is the left ventricle will compensate and it will thicken the walls, which is called hypertrophy, to generate more force to pump blood through the narrow valves. Over the time with this hypertrophy, it can lead to increased pressure and reduced cardiac output and even lead to heart failure. Some common symptoms that you're going to see with aortic stenosis include chest pain due to the restrictive blood flow of the coronary arteries. You're also going to see shortness of breath caused by the fluid buildup in the lungs. As it's not able to leave the heart, it's going to back up into the lungs, and the heart will struggle to pump effectively. You also have fatigue as the blood isn't able to get to all of the organs in the body and give that oxygen delivery. You'll see some fatigue with that. You also can have dizziness and fainting, which can occur as the heart cannot meet the body's increased demands for blood. And then you also can hear a heart murmur. So as we listen to your heart with our stethoscopes, we'll be able to hear the crescendo and decrescendo murmur that is going on as you listen. The good thing is you do have a mild case. The expected outcome is very good. You had no idea that you even had this aortic stenosis when you came in. I was just able to hear it as I was doing a checkup. So as you see, like with mild cases, you often remain asymptomatic for years. And we'll just keep monitoring it. As it does, if it does progress and gets to like maybe a moderate or severe case, your symptoms will worsen over time. So you'll start to see those symptoms that I was talking about of chest pain and shortness of breath or dizziness. And it can lead to complications like heart failure, so arrhythmias, or if left untreated, it can lead to cardiac death. But we are going to prevent that by watching it and making sure your heart is staying healthy and everything is working well. The treatment that we would see, so if this does progress and if it gets worse, we can look into maybe doing a valve replacement, which can significantly improve the symptoms, as it would just replace that swollen and narrowed valve and just make sure that you're getting all the blood flow that you need and it's not causing any backup into the lungs and it's keeping you healthy. Hopefully this kind of cleared up what's going on. So as of now, we're just going to monitor. We're not going to do anything more. But if it does progress and it continues to get worse or continues to narrow and cause less blood flow, we will be looking into a valve replacement.